Good morning. As you can probably hear from my accent, I'm not originally from New Zealand, but can actually say I am now a New Zealand citizen. Have been here about 8 years, and was very pleased to be invited to speak to you, although I am not in the respiratory field, but I am a clinical psychologist who works with kids and families with very high and complex needs. And wraparound services really is something that is starting to go. It originated in the mental health field, but is now starting to go into the medical field, go into geriatrics, a number of different populations because of its application. And I want to start off with a little story. This is not good because I can't see my slides, but I will try. Oh, there we go. Yeah, I'm too short to see my slides. That's the problem. Thank you, because I do have to read some of it. But I want to start off with, just think for a minute. Imagine if you were trying to get your car fixed and it broke down, and you find out that you have to take it to a different garage to fix each part. One garage to look at the brake cable, one garage to check the windscreen, one garage to check the tires. And then even more so, you have to go to these garages in different areas, and they don't speak to each other, and you have to fill out multiple forms at each garage and retell your story over and over again. And we would think that that would be really absurd as a way of having to fix a car. But that's what we do within our medical field, within our mental health field, and what happens to a lot of families that have high and complex needs. And so wraparound is a term that is used in a variety of different capacities. And wraparound really started to try and coordinate care and try and coordinate services for clients so that they have one plan, one contact, and that it's an integrated service. And when wraparound started, it started back in the late 1980s around mental health. And at that time, it was really wrapping services around families, trying to figure out how to have the services more community-based, more applicable to the families, integrating one plan. And what we found with wraparound is that when we were throwing a lot of services at families, yes, it was propping them up, but it wasn't having sustainable change. And over the years, there's really been a lot of research in looking at how to have change sustainable with kids and families and how to make wraparound more effective. And there's actually a research-based model that we are now using much more effectively that is more than just wrapping services around families. It's actually a research-based model of care planning and a system of care. And what it really is a philosophical approach to care planning. So it's about how we do that planning. It has principles, it has a model of delivery, it has a theory of change, and it's the combination of these principles, stages, delivery that actually make wraparound effective rather than just the services per se. So we hear the term wraparound a lot used as just a package of services for families, but it's not just that, and it's not just a funding stream, because oftentimes with high and complex needs youth that are in wraparound, there is flexible funding attached, but that's not what wraparound is. So you just don't want to wrap the family, you actually want to be able to follow the model. And a lot of people were talking today about the needs to engage families, the needs to access resources. And this is one way to do it. And so When we talk about wraparound, I really want people to start to think about that it's a definable planning process involving the child and family that actually results in a unique set of community services and natural supports, which are individualized for that child and family to achieve positive outcomes. So why do we need wraparound? Oftentimes when we find that clients or patients aren't engaged into their treatment or engaged into their following through with appointments, following through with medication, following through with recommendation, it's because it's not meeting their needs. They have some very complex needs that may be individualized. People were talking about that it's not just the asthma or the following through with the treatment, but there's issues with housing, warm environments, access to medication, access to funding. That it's not just looking at the one aspect, but looking at the person as a whole. So we really need to find a way to engage these patients and have them be active participants in their treatment. And so they really need to be heard. So we need to listen to what they have to say and not assume that we have the answers. They need a single plan. I think somebody earlier was talking about how somebody had to go to this person and that person, and what it was is bringing that all into one area or one kind of stop shop so that their services are coordinated. Because oftentimes we have families that have multiple needs, or clients that we're working with multiple needs. They're supposed to be at this doctor, and then they have to go to this community service, and then they have to go to WINS to get funding, and then they have to, try and get a different housing. And I don't know if, I work full-time, and I can barely make time to get to an appointment once or twice a week if I had something, let alone somebody who's got 5 to 10 appointments that they're supposed to attend in a week. And then we tell them that they need to be working, and why aren't they working full-time, and why aren't they doing this, and so on. Sometimes accessing these services alone is a full-time job. And so we need to make it much more accessible and coordinated for them. And finally, we really need to look at how we serve these clients within their communities and have the resources available within their communities and actually start to use and build on their natural supports. And it's building on those natural supports and providing services within their community that is going to actually lead to that sustainable change. And we have to get creative in the way that we start to look at how to meet clients' needs and not assume that we have the answers. So with the research-based model of wraparound, there are 3 primary goals for wraparound. One is to ensure that clients have access to the people and the processes in which decisions as well are that have access to the people and process in which the decisions are made about them. And then also access to the resources needed to provide them and meet those, provide for their needs and meet their service needs. The other thing is that we need to ensure that the clients have a voice, and that's that they are actually full participants and decision makers in their treatment process. None of us like being told what to do. We actually like to have a say in how we do it and what we need to do. And so we need to remember that when we're working with people is we need to hear their perspective and not make assumptions, and that they have a right to be a decision maker in their own treatment. And when people are a decision maker in their own treatment, they actually take more ownership of it. And so Wraparound really tries to ensure that ownership over the treatment plan, over the process, is ensured with clients. So with the research model, there are 5 key elements that need to be a part of the process in order to ensure that you're actually doing high fidelity wraparound. And those key elements are that it's grounded in a strength perspective. So we talk a lot about strength-based approaches, but when we talk about a strength-based perspective in wraparound, what we're really talking about is utilizing the strengths of that individual to build on and to build the treatment plan around. That it's driven by underlying needs. So behavior is a result of an unmet need often. So somebody not complying with medication, we need to understand what that unmet need is. And I'll go a little bit into how we do that a little bit later. That it's supported by an effective team process so that you have a team working with these people and that team is actually communicating with each other, that they're actually making decisions together, that it's not a competition as who has the best idea, but it's oftentimes because, and one of the things, within the medical field, within the mental health field, is that sometimes it can be very hierarchical. And one of the things with wraparound is there is no hierarchy. And actually, it is the family or the client or patient that has the ultimate say. So we've got to work on making effective teams. That does take time. I heard people talking about, in the examples earlier today, the importance of building the relationships. The relationships that you build within your community are absolutely essential to effective wraparound. And you've got to build those teams effectively too. And that can be time consuming in the beginning, but in the long run, it's going to save you time once you have established those relationships. And oftentimes it's talking with the different members of the team, working with the family about the importance of the principles and the goals of wraparound and why we are doing things in a certain way. The other thing is that the services and the plans are determined by the family. That doesn't mean that we do what the family says, but what it means is that we ensure that the family has the information that they need to make good decisions, that we hear their perspective, that we understand what their underlying needs are, and we understand kind of what their hopes are so that we can help them move closer to that. And finally, it's really important that things are outcome-based. The reason, and actually that's a new element that has just been added in the last 2 years, I would say. But one of the things is it's really important to measure that change is occurring. Because oftentimes when you're in the midst of it, you don't see the change happening. Even though that change is occurring, and it's really important for families or patients to see that they have made small changes and that they are moving towards their goal so that they can start to get a sense of self-efficacy and feel more empowered around their own treatment process. So, what is the research model of wraparound? There are actually 10 guiding principles that all center around the primary principle of family voice and choice. Everything that we do in wraparound is that we, like I said, we make sure that the family has a voice and they have some say over the process. We want to make sure that the service is individualized, that it's strength-based, that we're utilizing natural supports and trying to build natural support systems, that it's collaborative, that we're persistent, that we don't give up, because sometimes these families are difficult to engage, sometimes it's meeting with them after hours, and I think somebody from the woman from South Auckland, you were talking about that it's not that the client, that we have bad clients or problematic clients, it's that we haven't found the right match of service for them. And that's an underlying philosophy with Wraparound and the whole idea around that persistence, that we have to persist on to find the right match. We want to make sure that the services are community-based, that they're culturally competent, that we're working effectively as a team, and that it's outcome-based. So these principles have to be a part of everything we do in Wraparound. The other thing with Wraparound is that with the research-based model, there's actually 4 phases to it. And oftentimes, that whole first phase doesn't occur with Wraparound, which is actually the key phase. So that's sitting down with the family and hearing the family story, being able to start to identify their needs, be able to start to identify their strengths. And we do that oftentimes by hearing the family story, and not just around the presenting problem. We want to hear what life has been like for that person. And we actually sometimes, one of the tools that we use is using a timeline and starting with that person from their birth and what life has been like them. Because what that's going to do is also help us identify strengths that we see with them. Because you can't just say to a family, what are your strengths? Or to a patient, what are your strengths? You need to be able to help identify those by listening to what their story is. The other key component there is the team preparation. So I spoke a little bit about that earlier. When you're working with new providers that are going to be a part of that team, that are working with that family, really explaining to them the wraparound process and why some of the principles are important, why the family's voice is important, and why you're incorporating that. And if you look at that, the phases, they all kind of overlap each other. It's not like you do the engagement and you're done. You're not, doing initial plan development and done. It's an ongoing process throughout the whole time you're working with that family. And the other thing that's really important is that you're always talking about transition, because you want to transition the family to be able to sustain the services on their own, or be access to those services so that it's not needing to have that constant coordination. So why does Wraparound work? There is a theory of change that has been developed in the last, I would say, 10 years, that there's been a lot of research on Wraparound, looking at the principles, looking at the phases. So, like I said, when Wraparound started in the 90s, or the late 80s, early 90s, there were no principles, there were no phases, there was no theory of change. This is all work that has come out of really looking at the process, examining the process, and trying to make sense of it. So in, I think, 2008, a theory of change was developed that looked at why is it that the principles are important? Why is it that the phases are important? And what they've come up with are 2 kind of intermediate pathways of change that really impact the change with the family. And so this is the theory of change. If you look at kind of the far end, it looks at the 10 principles and the phases. If you have that, you're going to have a wraparound process that's going to be characterized by high quality planning and problem solving, respect for values and culture, blending of perspectives. Is going to be family driven or and youth guided. And this is the model that's used with youth and family and mental health. There's going to be opportunities for choice, it's going to be individualized, and you're going to be evaluating strategies on an ongoing basis and celebrating and recognizing success. And when you do that, you're going to have the client be able to follow through more. They're going to be more engaged in the process. The services are actually going to be based on their strengths. You're going to get more follow through from the team, and that people are going to start to get that feeling of success and experience a sense of efficacy. Which then leads us into the intermediate outcomes, that if you've got your team working well, that the supports and the services are going to fit for the family. And then when the services and supports fit from the family and they're a decision maker, they're exposed to having to do the problem solving within the team. So you're going to build their increase their capacity for coping and planning and problem solving. You're celebrating their successes and pointing out when things are succeeding, so you're outcome-based, which leads to self-efficacy, empowerment, optimism, self-esteem. And because you're community-based and building on their natural resources, they're going to be less socially isolated, they're reintegrating into the community, they're more likely to be able to use the social supports around them, and you're achieving the goals. And the long-term goals, these are the goals that you're looking at for kids that have mental health issues, but in the medical field, what it would look at is more compliance in treatment, better health, better follow-through, kind of the examples or the outcomes that the group earlier were telling us about that they had with their clients. So if we look at these two different packages, these two different pathways, like I said, I think I actually already went through all of those. I guess I should have done it through the slides, but anyway, so like I said, your services are going to fit more. They're going to also match the functional strengths of the family, and we're going to improve access, engagement, and retention with the clients and a commitment to the service. Like I said, we're going to be building on the family's assets because they're experiencing proactive planning and coping. They're seeing the process occurring, so those skills are going to develop with them. The other thing is when we're talking about the family strengths, the family often doesn't identify those strengths or see those strengths within themselves. And so when we start to do that with them, they start to feel a sense of hope. They start to be able to see that things could change in their family, and they also start to have a changed meaning around their story. So understanding why they're doing things a certain way and not focusing on it being negative or them not being able to follow through. So like I said, we're looking at those 5 key elements. I'm going to talk about 2 of those, one being the strength-based perspective and the other being the underlying needs. Because oftentimes when we think of needs, we think of something that's strongly desired, like the family needs to find stable housing in a safe neighborhood, or an obligation. Tim needs to take his medication. Or a necessary step towards accomplishing something. Susan needs to participate in respite so Miss Watkins can have a break. Or something that is missing or lacking important to health. Miss Roberts needs to be connected to the food bank in order to provide food to their family. But in Wraparound, we think of needs different than services. Oftentimes we say, they need to go to therapy, they need a class, they need substance abuse treatment, they need an assessment. But what we're really looking for is that underlying need, because that underlying need can open up an opportunity of a variety of ways to meet that need versus a service. So instead of somebody needing therapy, they maybe need someone to talk to who that they can trust. And that need could be met during a number of different ways. Or if they need some or some education about their condition, what they really need is to feel competent in control of their condition. So in Wraparound, we don't think of services as fulfilling needs. We want to get to that underlying need so that we can actually have a discussion and brainstorm about different ideas and ways that that need can be met, because families often have different ways that those needs can be met that we need to consider as part of their treatment. So the way we think about needs in Wraparound is it's a set of conditions that causes a behavior or situation to occur or not occur, and explains the underlying reasons why behaviors or a situation happens. So one of the things that we think about with needs is that challenging behaviors are actually a result of an unmet need, that needs are not services or goals, that all behavior is actually communication, that if a behavior doesn't change, it's a signal to you that you need to change something you are doing. And this is what you were talking about earlier with the services. And that well-written need statements will modify the context in which the family sees their current situation. So instead of seeing it as a problematic situation, they see it as something that can be overcome. And I like this saying. This was a mentor of mine who trained me in Wraparound. But she says, needs can be described as the holes in our hearts that drive us to do the things we shouldn't and keep us from doing the things that we should. So the other key component is strengths and using strengths in Wraparound. And we've got a few key assumptions about strengths, and they can be interests, talents, or other unique contributions that make things better for the family or an individual. And everyone has unique strengths. All environments have strengths to be built on. Change is supported by building on these strengths. By looking at strengths as a way of reframing challenges. Strengths can be used at a time when things are difficult and we can't think of other things that may be helpful. And so, like I said, we are identifying these strengths for families or kids. But what we're really looking for is not descriptive strengths like she's a good cook, he's good at rugby. We're looking at functional strengths, and functional strengths are those things that we can utilize then as part of the plan. So for example, if he's good at rugby, okay, well, why is he good at rugby? Is it because he's a good team player and can cooperate and get along well with others? Is it because he's able to think several steps ahead and is good at planning? Is he good at strategy? So when you've got somebody as a good team player or communicates well, those are things that you can utilize or are functional in your planning to help build on. And one of the ways that we go about trying to find these strengths is by asking questions like, how have they dealt with challenges in the past? What are their survival skills? Who have they turned to in the past? This probably isn't the first time, the presenting problem isn't usually the first time they're coming to our attention. How have they dealt with it in the past? So we ask those kinds of questions and then reflect those back to the family as a way of starting for them to see some of their strengths and a way for us to start to build a plan around those strengths and utilizing those strengths. There's a number of other components to Wraparound, but given a 30-minute situation, that's as much as I can tell you about Wraparound. But one of the things, I saw this on Facebook, and it really fits for Wraparound, because we in Wraparound don't feel that we hold the answers for a family, that a family probably holds the answers for themselves. And this happens in teams a lot, because it's like, no, that's not right. No, you know, my way's better. But just because you're right doesn't mean I'm wrong. You just haven't seen life from my position. Thank you.